and welcome to Disorient Episode 8. What is depression? I want to start by saying I'm not a mental health professional. I'm a peer with lived experience. I want to get this really important information on depression out to you, my fellow Asian Americans, and let you know that this information is based on my reading, lived experience, and others' stories. Before we move on, this is really important. Here are crisis resources for if you're really struggling and are at risk of harming yourself or others. Please know that no, you don't need an official pre-existing diagnosis to seek help. You deserve help. There are people who can help, and I hope that if you need help, you're able to seek it. Please reach out for help if you need it, and if you know anyone who might need support, please reach out to them and ask how they're doing if you're able. Sometimes that can make all the difference. And a content warning, I will be mentioning suicide briefly in this video. So let's talk about depression. There's so much I want to say, but I want to start with Asian Americans can have depression too. We're not robots. We're not less likely to be depressed just because we're Asian and feel more cultural pressure to try harder and do well. Also, high educational attainment and financial status don't prevent depression. Depression is complicated for Asian Americans especially. Our Asian heritage cultures see mental illness often as shameful and taboo. Then add in our reluctance to seek help for mental illness and our collectivist values that tell us to keep our emotions to ourselves to maintain social harmony. And for those of us who grew up in the US, we also deal with the confusion of navigating two often conflicting cultures and the American stigma against mental illness. So our parents and community members may not know when or how to find a therapist, or that therapists exist in the first place. And so us second-plus generation Asian Americans don't learn that therapy exists, and we don't know that we can even get help. So basically, experiencing depression or any mental illness as an Asian American can be an incredibly lonely and shameful experience. I've heard Asian Americans make jokes that it's a white person thing to be depressed and go to therapy, and I have to disagree. Just because we're not white, just because we're so reluctant to talk about therapy and depression, doesn't mean that depression doesn't affect us. In fact, the Asian American community is struggling with depression big time. We're all humans, and so we all have the capacity to become depressed, including Asian Americans. According to the National Institute of Mental Health, as of 2017, almost 7% of the adults in the US had at least one major depressive episode in the past year. So, was depressed in the past year. The World Health Organization estimates that 4 to 5% of people in Asia are struggling with depression. So, depression isn't just a Western thing. And depression isn't rare at all. It's one of the leading causes of disability worldwide. In my mind, the difference between suffering with depression and living as well as possible with it is whether we acknowledge how we're feeling, whether we seek help, and whether we acquire the skills to manage stress and depression to live a healthy life. It's so common for us Asian Americans to be raised to not acknowledge and express our feelings, to avoid seeking help, and to address all problems by just working harder, aka through brute force. So we don't address our feelings, and we struggle to seek help, doing so 3 times less than the general US population. Because we seek help so rarely, we often don't get diagnosed with depression until we're in crisis, if at all. And so statistics on depression might show low rates in Asian Americans, 4.4% in 2017, which was the lowest, but that's diagnosed depression. So if we don't seek diagnosis and treatment, well, no one's going to know. But that doesn't mean that we're less likely to experience depression. Asian Americans absolutely experience depression, but oftentimes we're culturally conditioned to suffer in silence. Low rates of help seeking for depression is a very serious mental health and public health issue because depression is so common. And when left untreated, it can lead to suicidal ideation and suicide. Currently, the Asian American community, myself included, is very much struggling with and slowly working on addressing depression in the community. And our allies, white and of color, are helping us too. Let's start by wrapping our heads around what depression is. Actually, before we get into what depression is, I want to explore why depression is and why it's not. Depression does not happen because you are weak, shameful, or a failure. If someone has ever insulted or shamed you for feeling depressed as an attempt to get you to toughen up or get over it, I'm sorry. And the thing is that toughening up might work in the moment, but it ultimately doesn't really work. Not addressing depression comes back to bite you, as it did to me. I wish that people's well-meaning efforts weren't so misguided and hurtful. And I want you to know that if you've ever felt depressed, it's not your fault, and it is not because you are weak. Depression also doesn't happen as a result of mere chemical imbalance in your brain. Therefore, you can't magically cure depression with antidepressants alone, really. Yes, shifting your brain chemistry with medication can help alleviate symptoms of depression, but the cause of depression is much more complicated than just some brain chemicals out of whack. What does cause depression is a complex mix of biological, psychological, and social factors that result in what's basically a behavioral shutdown, which we call depression. Depression might run in the family because of genes that make you more likely to become depressed. You might have a sensitive nervous system like mine that may be more prone to depression. You might have grown up in a toxic home or school environment or experienced a lot of hardship or loss. You might struggle with loneliness, learned helplessness, perfectionism, or distorted thinking styles. Any combination of these factors can make you more likely to have depression. So basically, it's complicated. Also, one more misconception. People sometimes say the phrases, "that's so depressing," or "oh my god, I'm so depressed," lightly, and use the word depressed as a synonym for sad. Depression is not sadness, which would be an expected or reasonable sad reaction to a situation, nor is it grief from a loss, although you can absolutely seek support for sadness and grief. Depression is much more serious than 1 or 2 days of feeling down, and it's different from immense grief that would be completely expected after a major loss. So, now we have the misconceptions out of the way. What is depression? Again, I'll be paraphrasing the DSM-5, which is the diagnostic manual and guidelines used in the US to diagnose mental illness. The DSM is used for insurance, and it's not like 100% set in stone. It does change over time when the psych people decide to tweak it. As with basically all psychiatric conditions, diagnosable depression causes an individual significant distress and interferes with daily functioning in multiple areas, be it home, work, or your social life. Also note that it's possible to ignore, hide, or deny feeling depressed and looking like you're still able to function, especially if your depressive symptoms aren't too severe. But if you're suffering inside, you're suffering. And trying to wish depression away doesn't really work, believe me. Depression comes in varying levels of severity, mild, moderate, and severe, and one might experience many or a few symptoms, which may include physical symptoms such as sleeping too little or too much, eating too little or too much, or having significant weight loss or weight gain, feeling fatigue and loss of energy, or feeling slowed down, like I can't move, I can't get out of bed, and doing anything feels like walking through really, really thick mud. Other physical symptoms are headaches, stomach problems, chronic pain. Depression showing up as physical symptoms is called somatization and is common in Asian Americans. Depression can also affect your mental state. Whether it's lack of interest, the fancy word is anhedonia, in I don't want to do anything, even activities you typically enjoy. And this lack of interest and energy can lead to social isolation because you just don't have enough energy to reach out and interact with people. You might have a hard time concentrating and very little motivation. And depression can also affect your emotional state. You might have very negative beliefs about yourself, your self-worth, your past. Like, I'm worthless, I suck, my life sucks, I'm no good, I'm never good enough, I can't do anything right. You feel hopeless, like there's no point. Why bother? Everything is always bad. It's like rose-colored glasses except of darkness. And these negative thoughts can just turn in circles in your head, and that's called rumination. Or you might have more of a lack of feeling and feel nothing. Like, I feel like I should be crying, but I can't cry. I feel terrible somehow, but I also somehow don't really feel anything. And the most serious and severe symptoms of depression are suicidal ideation, which is suicidal thoughts such as I don't want to be here anymore, and planning to attempt suicide. At this point, this is a mental health emergency, especially if you've never experienced or received help for mental health. So if you find yourself or someone else in a position like this, please, 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 please seek help. I know it's hard and takes so much courage to do so, but there is help out there. And it is okay to feel this way, even though it feels unbearable. If you are in this place, contact your therapist if you have one, get a mental health evaluation, call 911, call a crisis hotline, tell a trusted friend, family member, or a teacher who might be able to be with you and help. Your safety is most important, and there are people who can help keep you safe. And also note that there are also people who might make things worse by saying or doing hurtful or unhelpful things. So choose who you can trust and learn best practices for suicide prevention. If possible, it's really great to notice and seek help for symptoms of depression before they get so severe that you get to crisis mode. It's a lot harder to recover when you're that deep in depression. And getting help and support earlier can lessen the pain and possibly even prevent future mental health emergencies. As I mentioned in my anxiety video, depression often co-occurs with anxiety, and they're often best buddies. The difference is that depression is more feeling bad about the past, and anxiety is worrying about the future. Also, not totally related, but adults and children can have depression, so it's not just an adult thing. Now for types of depression. There are different types of depression that vary in duration and intensity of symptoms and what triggers them. I think it's important to note that depression isn't necessarily a constant state. It can be a one-time occurrence, be constant or go more in and out, or be more chronic. You might struggle with one type of depression, or with a combination, or with other things. So it's not just like, are you depressed, yay or nay? It can often be more complicated than that. So for types of depression, major depressive disorder is our classic depression. Major depression is diagnosed when a person has depressive symptoms for at least 2 consecutive weeks that really interfere with their daily functioning. Persistent depressive disorder, which used to be called dysthymia, entails depressive symptoms that are less intense than major depression, but are much longer lasting and constant, lasting for 2 years or more. And persistent depressive disorder can include major depressive episodes within it. Seasonal affective disorder is a kind of depression that starts and ends at about the same time every year, usually with the changing of seasons. Usually, seasonal depression has a winter onset that's triggered by reduced sunlight, but some people have spring and summer onset seasonal depression. And for seasonal affective disorder, it's the changes in the sunlight that affects your circadian rhythm, which is your biological clock, and messes with your melatonin levels, which regulate sleep, and your serotonin levels, which regulate your mood. And for those of us with feminine reproductive organs and hormones, we face the fun possibility of having these types of depression. Premenstrual dysphoric disorder, which is a more severe premenstrual syndrome, PMS, that can include depression and anxiety from our hormones falling after ovulation. And perinatal depression, which is depression during and after pregnancy. Depression after pregnancy is often called postpartum depression. And the typical baby blues after giving birth is normal when it lasts up to 2 weeks. But when it lasts longer than that, then it's considered postpartum depression. And some other types of depression that are less common are psychotic depression, which is a very severe depression that is accompanied by psychosis, which might include hallucinations like hearing voices, delusions like feeling like you have committed a sin, or other breaks from reality that are related to depression. Also, depression is a part of bipolar disorder, which involves episodes of depression and either hypomania or mania, which can entail anger, irritability, euphoria, and or depression. I'll cover bipolar more in depth in a later Disorient episode, but basically there are 2 types of bipolar 1 and bipolar 2, as well as a milder condition called cyclothymia. The recommended treatment for bipolar is different from treatment for depression alone, especially in regards to medication. And some treatments for depression, especially medication, can actually exacerbate hypomania or mania in bipolar disorder. So, that's the types of depression. Now, treatment for depression. Standard treatment for depression usually entails psychotherapy and medication used in tandem. Before we delve into that, though, depression treatment also involves lifestyle changes, including any kind of exercise, especially regular and moderate cardio, which naturally relieves many symptoms of depression by increasing production of mood-boosting neurotransmitters like serotonin, dopamine, norepinephrine, etc. But again, depression is not just, oh, my brain chemicals are out of whack, it's more complicated. Eating well is also helpful in managing depression. Keeping your body well-fueled with nutritious food keeps your mind well-fueled, and our mind and body are totally connected. And social connection is essential for our well-being. We're social creatures, so having opportunities to talk and spend time with people we like helps us feel more at ease and like we belong. And for seasonal depression, light therapy is a very important treatment. And now the staples of depression treatment, psychotherapy and medication. So psychotherapy is really important for depression. There are many types of therapy that are effective with depression, including psychodynamic therapy, which is your modern day version of your lay on the couch Freudian talk therapy, except you probably won't be laying down during therapy, but you do explore your past to gain insight into your current struggles. Cognitive behavioral therapy is the other big one for depression, and it aims to address your current distorted thinking patterns. And there are newer types of CBT that incorporate mindfulness and acceptance, and these have a lot of roots in Buddhism, which I think is kind of cool. There's also interpersonal therapy, which focuses on improving social difficulties, and behavioral activation, which focuses on re-engaging you with the world. And the other big aspect of treating depression is medication. Usually, the first type of medication prescribed are SSRIs, selective serotonin reuptake inhibitors. But there are also SNRIs, which target norepinephrine rather than serotonin, and atypical antidepressants like Wellbutrin, as well as older antidepressants like MAOIs, I'm not going to say that, and tricyclic antidepressants. I'll talk about SSRIs since they're the most common. SSRIs usually take between 2 to 6 weeks to build up in your body and really kick in, and sometimes there are side effects like digestive issues or headaches, which can be rough. There are a bunch of different SSRIs, including Lexapro, Prozac, and Zoloft. Those are the brand names because I don't want to say the chemical names. And finding the right type and dose of antidepressant can require patience since the SSRIs take so long to go into effect. So it's really important to A, be patient, and B, don't abruptly stop using SSRIs because there might be withdrawal symptoms. And so there's so much media coverage of overprescribing of antidepressants and judgment over antidepressant use. The fact is that everyone will have their own philosophy and reasoning around medication. The decision to use medication or not is a personal choice. Some people are okay with starting with medication. Other people want to try non-medication options first, but are open to it if it helps. And other people absolutely don't want to take medication even if it helps. All of these stances are legit, and what matters is that you choose what feels right for you. And know that you can change your mind and decide to start and stop medications if your beliefs change. There's also a constant debate in the research community on the efficacy of antidepressants. And so, yes, there's the research data, but there's also whether the medication works for you as an individual. As with many types of medications, different kinds of antidepressants work for some people and don't work for others. Basically, in regards to medication, figure out what's best for you, your current situation and well-being, and your personal values. Remember that medication is just one way to treat depression, along with other modes like therapy and lifestyle changes. And for more severe or persistent depression that doesn't respond to therapy or medication, there are additional treatments including brain stimulation or neuromodulation therapies, including electroconvulsive therapy and transcranial magnetic stimulation. The drug ketamine is also used in treatment-resistant depression. I'm not all that familiar with how brain stimulation and ketamine work, so please do your research. But these treatments involve tweaking neurotransmitters or stimulating certain areas of your brain. Whew, okay. So, thank you for sticking with me through this exhaustive episode on depression. It's so not an easy topic. It's really tough, and it took me several months to make this episode because it's not easy to talk about this stuff. So, if you're going to take anything away from this video, I want you to know that there is help for depression, and you're not alone, even if you feel that way. And as always, thank you for watching Disorient, and I'll see you next time.